Hello everyone, I'm Lauren Collins and I'm a pelvic health physical therapist. Today I want to come and talk to you about something very near and dear to my heart, and that is working with survivors of sexual trauma and domestic violence. I am blessed to have grown up with a mother who played a significant role as an advocate for survivors of sexual assault and domestic violence, and in that it became a significant part of my life and of all the women around me. As a physical therapist who works in pelvic health, I screen all of my patients, and there's a significant number, I'm using this word significant a lot because it's there, of women who come to me with issues who are survivors. So if you are a survivor, or if you know someone who is a survivor, I hope that you find the information in this video helpful and are able to pass it along to someone else. So in starting this video further, I just want to say next to all of my survivors, please know that it's not your fault and you didn't do anything wrong. And the healing process, in my opinion, isn't just one thing. It's not just a mental healing, it's not just a spiritual healing, and it's not just a physical healing. It is all encompassing of spirit, mental, and physical. And in my opinion, again, that's how true healing happens. But also, the first step to healing, again, in my opinion, is to have awareness. So oftentimes when women come see me, they come and have issues around pain with intercourse or pain with gynecological exams or just general lower and back pain or bowel and bladder issues like painful bladders or constipation or diarrhea issues or something called irritable bowel syndrome. So all of these are symptoms, or low back pain, or just abdominal pain. So all of these are symptoms that people come to me with who are survivors. And so what I want to tell you too is that there is something that can be done to help with the pain issues. But again, healing is all encompassing. So when you're addressing the pain issues, I also recommend to people that I work with that they also have a mental health counselor, because in processing through all this, there you can trigger things, or things have been triggered, and you need to be able to heal through all of it. Okay, but from the physical therapy standpoint, what I will say is one thing to help bring awareness around where you're holding the trauma, especially if it's a pelvic related trauma, are things that you can do. As I mentioned before, one thing is like doing a Kegel exercise, sitting on the ball like I demonstrated in one of my previous videos, and finding those pelvic floor muscles, and just in a loving way, just gentle loving way, finding the muscles. You can practice sitting on the ball and just kind of trying to squeeze and release. That's one way to bring awareness around those muscles. Also, just touching yourself, whether it's touching yourself around your vulvar area, if you're comfortable with that, or just on your abdomen, just to bring some awareness, always, again, with loving intentions when you're ready to do something like that. Another way that I like to bring awareness with the people that I work with around their vulva and vagina without actually having to do a physical touch is through art. I love art. I give presentations to survivors, and part of my awareness activity that I give them is to do art. We make vulvas, and you don't have to be a quote unquote artist to make art. This is your representation of what you do. So I love that. So go grab some paints, or go grab some felts, or go grab, whatever you have in the house, some pencils and paper, and just sketch, draw, just let yourself go. But do it with loving intentions of just bringing some awareness around where you're trying to heal. The other thing that you can help to do is just to watch your posture. A lot of times people who are survivors of traumatic events, they have a guarding posture because that area hurts. Well, then those muscles and those tissues get restricted, which can cause some dysfunctions in other areas. So just kind of opening yourself up, stretching, sitting up nice and tall, getting your body in better alignment can also help to kind of stretch those tissues and just and help to heal them, to open them back up. You can get better breath in when you sit up tall. If you're in a posture where you're kind of guarded and protected, it's hard to breathe deep. So sitting up tall can help with that. And then taking some deep breaths. Breathe into the area that you're trying to heal. If it's your vulva and vagina, take some breaths and let the breath flow there. And just, again, bringing awareness there, but also letting some air, some breath flow there and getting the muscles to move better in there. Another thing you can do, because a lot of times when there's that traumatic event, the muscles that have been affected will tighten up to protect that area. And when they tighten up like that, over time, they become shortened, and that can be painful and cause some dysfunction as well. So doing things such as hip stretches, butt stretches, hamstring stretches, all of those things can help open you up and just kind of get things loose and limber again. And I will be doing another video on stretching the hip and butt and thigh muscles, so that can be there for you as well. So that's just kind of what I want to talk about, and to let you all know that I love you, and healing is here, and I will help as much as I can. If you do have any questions for me, if you want to do them and you're comfortable doing an open forum, you can please post them below, and I will be more than happy to answer them. If you would like to ask me a question more anonymously, if you go to my website, www.vitalselfpt.com, there's a contact page there, and you can contact me anonymously, and I can answer your questions that way. And there's also my email address there too, and I'd be more than happy to answer your questions from there. You can also follow me on Twitter at Lauren Vital Self, or you can go to my Facebook page, Vital Self Physical Therapy LLC. So I think that's it for today. I am sending, again, lots of love, light, peace, healing, and blessings out to all my survivors, women and men. And I love you all, and have a wonderful, wonderful, blessed evening, everyone. Bye.